Hello, I'm Holly Tanner with the Herman Wallace Pelvic Rehab Institute, and I'm here with Niko Gaffga today, and he's going to tell us about the course that he and his colleague Amy Meehan wrote about menstruation. Hi, Niko. Can you tell us a little bit about your background?
Good afternoon, Holly. Yes, thank you very much. First, I want to say thank you for the opportunity to be here, to work with Herman Wallace. And yeah, so I'm a family practice physician. I went to medical school in Alabama and residency in Arizona in family medicine. And I live now in Atlanta, Georgia. My family and I have lived all around the world in South America and Africa and many states in the United States, but all of it has been related to my work as a family medicine physician. One of the really cool things about family medicine is that we get to do a lot of different things, from geriatrics to pediatrics to obstetrics. I've delivered more than 100 babies, and I work now in occupational health. We worked for 4 years with prevention of mother-to-child transmission of HIV in Africa. And yeah, and so as time goes by, being a generalist, you sort of notice things that you like the best and things that you don't like as much. During my career, what I've noticed is that I like working in women's health issues more than anything else. It's the most rewarding and the most satisfying and interesting, frankly. It's a very interesting field to work in. And so I've gravitated towards that as my career has gone on. And I find myself working in Atlanta here with underserved populations, and I really enjoy the opportunities I have with my patients to do women's health issues. I see both men and women, and we do diabetes, high blood pressure, obesity, depression, all those kinds of things. But the thing that interests me the most and really gets me excited is doing women's health and with underserved populations, but any populations really.
Yeah.
So a
And
little
you
bit about
also,
me.
thank you. And you also work for the Centers for Disease Control.
I do. I've worked for many years in prevention of mother-to-child transmission of HIV, and I currently work in the CDC's clinic. We have a clinic for the employees of CDC to get healthcare, and I work at the headquarters in Atlanta for the CDC.
Wonderful. And
Yeah.
so, menstruation as a topic, what is it that got you so passionate about this particular topic and inspired you to write a course for Herman Wallace? What was that pathway?
Oh my gosh, I was just saying I could talk about this for hours. So, it's interesting. Throughout my career and my training, women's health and OB has been one of my favorite the parts of my job. But I have to say, in recent years, there was a patient who really inspired me recently. I'd say about 4 or 5 years ago. I came into the room, and she was sitting in the corner, and into the exam room at the clinic where I work. And she was sitting in the corner, and she was crying.
Mm.
And I came in and I asked, I said, she only spoke Spanish. So I asked her, how are you doing? What's happening? And she was very reluctant to say anything. And I found out through a little bit of discussion that she was feeling pain, and then she couldn't make the pain go away, and that she had seen many doctors about it and no one had been able to help her. And so she was reluctant to show me where on her body. Maybe it's because I'm a man, maybe it's because she was in a different country, she didn't feel secure. But so I drew a little picture on a piece of paper, and I said, just point to me on this paper where you feel the pain. After a while of pointing and talking and smiling, I sort of got to a point where she could explain to me what was happening. And it turns out that she had painful bladder syndrome or interstitial cystitis, and we worked over the months to get that better. And I have to say, the next time I walked into that same room and she was there, she was smiling and she stood up and she gave me a hug. And I said, this is why I do medicine. But I think the breakthrough came when I met her where she was. I took the time to talk to her in her language, show her a piece of paper, wait for her to say what she felt, what she was feeling. Because many doctors, have only 2 or 3 minutes to talk with their patients. But when I met her halfway, she was able to talk to me about the pain she was feeling, about her menstrual cycles, which I don't think she had ever discussed with any doctors before. And so that was sort of started me down the road of being interested in what can I do, what more can I do to help women. And when I see women in the clinic, a lot of them don't want to say anything about their menstrual cycle. And again, maybe it's because I'm a man, maybe it's because it's just a difficult topic to discuss. But I realize that in society, we don't have a lot of chance as men or women to talk about the menstrual cycle. And I feel that's a disservice to women and to men. But I feel it's a disservice to women that they don't have a chance to talk about things that genuinely interest them or concerning to them or have questions about or are curious about. And I feel there's a lot of stigma that I think that this course will begin to address it within a small group, but I think eventually training and working with healthcare providers is one step in making that message available to other people, to other patients all around the country. So that's sort of how it evolved for me.
That's beautiful. Thanks for sharing that. And how then did you get connected with Herman and Wallace?
Oh my gosh. So it was actually through that patient I mentioned before. I was wondering, we don't get a lot of training on IC, interstitial cystitis, as physicians. Don't know why, but we don't. So fortunately, I was able to help her through medical help, through medical with treatments and medications. But I started to wonder, are there things that I could do differently or to help patients? Because when you look in medical textbooks, it doesn't talk about a lot of the things that physical therapists do. So I looked on the internet and I found this company called Herman Wallace, and I said, that's interesting. I wonder what they do. So I signed up for a class, PF1. I took it in Athens, Georgia, about I think 2019 or maybe 18. And I got to the class, and I was one of maybe two males with about 50 or 60 people. This is before COVID. And when I saw what was going on, I thought, oh my gosh, what have I gotten myself into? But it turned out to be the best weekend. It was a 3-day course back then, and it was amazing. And I thought, what an eye-opening experience to see how other professionals, how other healthcare professionals tr- take care of their patients. And I have learned so much from Herman Wallace. I've been taking all the pelvic floor series and been a TA for all the classes, and I have learned so much that I've incorporated into my clinic. And I hope I can impart as a TA to the other participants the things that I know from my background. So I learn much from you, and I hope I give back to the participants who take the classes at Herman and Wallace.
And so, as a medical provider, certainly we've had more courses at the Institute now who are giving a medical perspective. So, not only can we understand what the options are, whether it's towards medical screening and referral, or discussing with our patients what things they might be able to experience at the doctor's office to be able to better communicate, and all of those great reasons. Um, how are you creating this course so that it is directed to pelvic rehab clinicians for the most part, and
Yes.
with that medical lens on it?
Sure, that's a great question. This is something that I thought about many times as I was developing the course over the past 4 or 5 years. Um, I it is focused on how to help patients. It is focused on how healthcare providers can help their patients. There's tools that are meant to be quite simple because I don't think that the menstrual experience should be the majority of a person's job, of a physical therapist's job, but it is important to take into account. So I have these succinct documents, for example, an intake questionnaire about the menstrual cycle, about the menstrual experience. And I feel like the menstrual experience is a different way to say it than the menstrual cycle because the experience is everything above and beyond the emotional feelings that someone has at different points in the cycle. So there's an intake questionnaire. There's some interventions that people can do that can help their patients do. There's succinct one-page documents that people can help investigate the issues that the patients are having with their menstrual experience and improve those. So it's a mixture of understanding the cycle and the experience and also interventions to improve the experience.
Mm. And you have a colleague who's helping you out with some of
Yes.
the material.
Dr. Amy Meehan, she is wonderful. She also works here in Atlanta, and I met her at through a Herman Wallace class, and we just she was the owner of the office where I was working, and at the end of the class, we started talking about menstrual cups, menstrual discs, and we just had this conversation, and it just came to be a great relationship that we've had since that time. And she is an excellent physical therapist here in Atlanta, pelvic floor therapist here in Atlanta, and she brings a perspective to this course that I feel is very important. First of all, she does what physical therapists do every day, and so she knows what the common questions are, the common concerns are when you're seeing a patient in a physical therapy setting. And she also is really experienced and expert in exercise and yoga and those kinds of things. And she brings a great perspective to the course during the recorded sessions and also during the live sessions.
Mhm. One of the things that is most compelling about this course and your involvement in creating it with Amy's help is your passion about this topic. And if someone said to you, what is it about menstruation? Why do you get so excited? What kind of feedback do you get from people when you do engage them in these conversations?
Yes, all kinds of feedback. I was recently at a dinner. We went to dinner with some friends, and we started. The other person at the table was a pelvic floor physical therapist, and we had probably a 20-minute conversation among males and females about menstruation in a restaurant. And I thought, this probably doesn't happen that often, but why not? Why shouldn't it? Maybe it's not everyone's favorite topic, and that's fine. It shouldn't be the first thing to talk about when you walk in the door at a dinner party, but why not?
Mhm.
So I think the thing that really makes it women's health and passion makes me passionate about women's health and menstruate and the menstrual cycle and the menstrual experience in particular is one that it's something that half of the world experiences, and yet we don't get to talk about it. And half of the world has an experience, the other half potentially does not, but there's no room to talk about that. And I don't think it's fair for anyone to not have that opportunity to talk about it. Um, I think that another thing that's important is that it's very interesting. The menstrual experience has the cycle, the hormones, the anatomy, the physiology are fascinating from an outside perspective, I have to say. But I think one of the most important things that it for me is that talking about the menstrual experience and women's health in general allows me to give people information to make decisions in their life that are in alignment with the way they see the world. I think not many professions can say that. The medical profession, physical therapists and doctors and many professions, we help people do what they want to do for themselves, and that's powerful. That's very powerful. And I think the maybe the most important thing is I can make a difference in someone else's life, and I've seen it talking to women in the clinic who I've seen before, discussing their menstrual cycle, having them tell me this is the first time I've spoken about it to anyone, much less to a female provider or a male provider. Hearing someone say that is meaningful. It's a lot of trust that they place in someone to tell them these kinds of things because they're difficult topics. But seeing that you can make a difference in someone else's life is I call it being a menstrual mentor. I think we've talked about this before, Holly. Being a menstrual mentor to somebody else and is a life-changing event. And it means a lot to me. I think those are the reasons why.
Yeah. Well, Nico, we're so excited that you have been able to bring this idea to fruition and that so many people are going to get to hear your perspective and learn from your knowledge that you and Amy have put together this great course. So thanks so much for sharing your thoughts on the class. And I think it's going to be a real hit.
Thank you very much. I'm so much looking forward to it. Thank you, Holly.